All right, Megan, so in just a sec, I will share my screen and I'll share the stimuli for this case and give you a second to just look through it, and then just let me know whenever you're ready and we'll get started with the encounter, okay?
Okay, thank you.
All right, so here is the stimulus.
Okay.
All right,
So
you ready?
just essentially their dizziness, and they're here to kind of talk a little bit more about what's going on.
Yep, so they're just here to present the case to you, okay?
Okay. Okay,
All
thank
right,
you.
I will stop sharing my screen now. I'll turn my video off and you can go ahead and get started as soon as you're ready, okay?
Okay, thank you.
Can you hear me, Dr. Carver?
Yep.
Hi. Yeah, I just wanted to let you know about the patient that I saw. You were
Sure.
busy. I'll read the notes. All right, cool. Mr. Martin Washington, a 73-year-old man who had a syncopal event 4 hours ago, maybe 5 now. He has a history of hypertension, hypercholesteremia, and is a pre-diabetic. His family noted that he was confused afterwards and may not been quite himself since it happened. He denies pain, but it's a little difficult to understand him as
Okay.
he mumbles a lot. He also
Okay.
denies headache, trouble breathing, chest discomfort, or lightheadedness. This occurred suddenly while he was on the phone, and he has been in good health before. His physical examination is notable for having normal vitals, normal heart sounds, normal lung sounds, and no leg swelling. I mean, it's strange. He doesn't really look at me if I'm on his right side, but is more interactive on his left side. And his right arm is a little weak, but he said it feels okay. So my plan is to check basic labs. His EKG already looks okay. I guess I should order a CT for his head. I don't know.
I think that's a really good thing for us to have. But you mentioned that it's like 4 hours, maybe 5 hours. Like that can be a really important time frame for us to work with. Do you remember how long it is that he's been here, or are you not sure?
Yeah, it's probably five now.
5
5 hours.
now? Okay. And you said you didn't come get me earlier. Why not?
You were busy. I mean, the floor is like so busy right now. I didn't want to come and interrupt you. I figured I'd just wait until you were done.
Okay. Okay. So next time, when you have an instance where it could potentially be a stroke victim, I would definitely say feel free to just at least let me know what's going on. So then that way I know how much time we have available to us. Just the difference between 4 hours and 5 hours can really be important when it comes to this. So please just, don't worry about it. Just interrupt me. It's okay. So I would say that, it sounds like definitely there could be a stroke going on. Next time, just come talk to me, please.
Yeah, I didn't want to because you were very busy in what you were doing, and it seemed like it was more important. Not to say that everything's not important, but
Right.
I've seen other attendings handling it this way, so I just wanted to be helpful and not bother you in what you were doing.
Okay. I totally get it. And, definitely, like you said, I mean, we are in the emergency department, so everything is kind of important. So I get that. But next time, just please bother me. So I would definitely say let's get the, huh?
Did I do something wrong? I don't.
I would say not necessarily, well, yes, if we're looking at the difference between, again, 4 hours and 5 hours, that could make a really big difference in terms of the outcome of this case. So, making sure that we get this done and we get him the care that he needs more quickly is pretty crucial. But I think you're right for the CT scan. Let's go ahead and do some blood work as well, just to check and see what his levels are. And then a neurological evaluation, just some further information so that we know where he's at right now. Next time, just come and get me, even if it seems like I'm doing something busy, and we'll go from there.
All right. Thank you, doctor.
Yeah.
All right, and now we can move on to feedback.
Okay.
Dr. Carver, that was amazing. How did you feel that it went?
I felt good about it. I was a little bit frustrated that, he didn't come over and talk to me, especially when it comes to like a stroke victim. Like, time is so valuable. And so even if there were other attendings that had been like leave me alone, don't bother me unless I'm free. When it's a case like that and it is so time sensitive, I guess I felt really frustrated by that. It seemed pretty obvious that he had made a mistake. So I don't know. I felt a little bit frustrated, and it kind of mirrors a little bit sometimes what happens when it's a busy day in the ED and people are trying to be a little too cautious, and it's like we just need to get things done.
Yeah, so I guess it does mirror real life sections, but this one's a little more contained. As the SP, I felt your frustration, but
Okay.
it came from a place of teaching rather than anything else, and that made me feel really good, and that I could do better going forward.
Okay. Okay. I guess, is there anything that I can maybe do like differently in terms of how I communicate? Because I also I want to be sure that we get things done, but I also don't want to scare people off.
Yes, your demeanor is very professional, which
Okay.
lends to the credence of this case. Um, Honestly, I think you're on the ball. It's nerves. It's
Yeah.
the environment that we're working in, which leads. As long as you're able to talk to somebody with respect and not come down on them, I think it's very positive.
Okay. Okay.
All right, Megan. So in just a second, I'll share my screen and I'll share the stimulus for this case and just give you a minute to look through it and kind of get into that mindset for this case. And then just let me know when you're ready to start. Okay.
Okay.
All right, so let me pull it up now.
Okay. How busy is it?
All right, just imagine a normal ER setting. So
Okay.
just like it would be in real life, that's what we'll be going for. And we can
Okay.
jump in whenever you're ready, okay? All right, I'm gonna stop sharing my screen
Okay.
and you can get
Okay.
started as soon as you're ready.
Sure. Oh, okay.
Hi, Dr. Carver.
Yes. Hi.
Yeah, I just wanted to go over the case of the patient I was seeing. I was trying to tell you earlier, but I
Yes. Go
can tell
ahead.
you now. Yeah.
Yes.
Okay. Yeah. So Mr. Martin Washington is a 73-year-old man who had a syncopal event 4 hours ago, or 5 hours ago now. He has a history of hypertension.
Sorry. Was it 4 hours or 5 hours ago?
I, I think it was now. It's probably 5 hours ago. Um,
So 5 hours.
Yeah, he's pre-diabetic. His family noted that he was confused afterwards. He's not been himself since. He denies pain, but it's a little difficult to understand him. He mumbles a lot. He also denies a headache, trouble breathing, chest discomfort, lightheadedness. This occurred suddenly while he was on the phone, and he has been in good health before.
Okay.
His physical examination is notable for normal vital sounds, normal heart sounds, normal lung sounds, no leg swelling. It's strange. He doesn't really look at me if I'm on his left side, but is more interactive if I'm on his left. His right arm is a little weak. But he says it feels okay.
Okay.
My plan is to check basic labs. His EKG already looks okay. I guess I should order a CT of his head. I think that's probably the
Yes.
next. Yeah.
Absolutely. That would seem a bit obvious to me, considering that we've got some drifting vision and we've got some slurred speech, and potentially it's been 5 hours since the incident happened. I would say that he's in a rather precarious position. Why didn't you come speak with me sooner?
Oh, it's because you were busy. You were doing other things, so I didn't want to bother you with this, and
I work in the emergency department. It's not really a bother for you to tell me what's necessary and what needs my attention. So you should just come and tell me when you need my help with something.
yeah, it's I really didn't want to because of the situation, and I literally just wanted to make sure that I was doing my job as well. So I just saw another patient in the meantime because we need to roll
So you saw another patient. I see. Okay. Yes, obviously we should have been working on this earlier. It's unfortunate now that we may have a different outcome because of your decision to wait. So what I think we should do is absolutely
Did
make
I
a
do
CT
something wrong?
scan.
I didn't. I don't. I'm not sure. Did I do something wrong?
Yes, you absolutely did. this was something where if we're looking at a potential stroke victim, time is of the essence, so you should have come and gotten me. But we're already too late for that. We're beyond the point where we can make some pretty important decisions. So we're going to work with what we have. I would say go ahead and take the CT scan, continue with the blood work, and come back with me as soon as you have more information. You understand?
Yeah. Yes,
Great.
doctor.
Thank you.
All right, we'll stop it there and just
Okay.
take a moment to come out of that environment, and then we'll just transition into feedback now, okay?
Okay. Sure.
All right, so if our standardized patient could come back on, and we'll discuss how that went.
Yeah. Thanks for that, Dr. Carver. How did that go for you?
I mean, I was really frustrated because, I mean, we're talking about a situation where a man clearly had a stroke, and for someone to be unclear as to how much time we have available to us is very frustrating and could mean the difference between a good outcome and a bad outcome. So the fact that he seemed so nonchalant about it was very frustrating. I had very little information to work with. I didn't know how busy it was that day. I didn't know that that I had been busy doing something else. It was, I had very little information available to me, and that felt very frustrating.
Okay. Just so you get the clear picture of what's going on here. This is a safe, standardized environment to help with heightened cases with lower thresholds. So whatever you are imagining may not be what the other person is imagining as well. From what I gathered, the way you spoke to me as the resident, it made me feel put out that I could not come and talk to you at all. I may have made a mistake, but it wasn't. I didn't feel like I could learn from it because I felt chided.
Okay. Even though I told you that you should come and get me.
Yeah, even that makes me feel that I don't want to come and talk to you because of the way that you will respond to me if that's the case. I don't actually know. You didn't even explain to me why the difference between 4 and 5 hours was detrimental to the case. You just said it and dismissed me.
Oh, I guess I just assumed that was something that you would have known. Okay. Okay. Interesting.
What else about this case? Because there is other information that we could get that is available to us. Did you want to ask more about all of that, or is it just straight?
No, I guess it was, you know, I know that in the emergency department, like you said, things can get pretty harried, and, you know, we only have so much information available to us in the moment. That very well could just be my own frustration with wanting to be able to provide the best care without having all the information available to me yet, because it's not available yet. So I suppose maybe I could take a look at that and take a step back, you know, and ask myself, if me getting upset about not having information available to me, is that this person's fault, or is that just time, I suppose.
I see. I also want to say that your care does come through. I did see the care for
Okay.
your work 100%. So that's not even a question of if your heart is in the right place. You were definitely doing your job.
And I have had people say that they've had some issues approaching me, that I can seem a bit standoffish, and sometimes I'm not sure why. So even though I tell them, like, come and get me if you need help. So I guess if there's anything else that I can possibly do to try to, I suppose, change my demeanor or make it feel that I'm a bit more approachable, I wouldn't mind, I guess, a suggestion or two for that if you have an idea.
Oh yeah, perfectly. If you want, even we could even run through the scenario again and like pick up different cues and ways to try to, because I feel it's best to work on things together.
Okay. Sure. Yeah.